It's live.
Greetings.
Wait. Mommy talk is. I'm gonna say it over. It's in setting up. Oh.
Mommy talk is live.
Yeah, Mommy talk is live.
Mm-hmm. Greetings, champion parents. Welcome back to Mommy Talk. As always, we are here to share information and resources to inspire positive parental engagement. I really like that, positive parental engagement. Ladies, snap with me. All right. We are real, relatable, and right on time. I am Dr. Pert. We have Miss Lisa and Miss April.
Hi.
Come talk to us by email and any of our social media platforms and let us know what you think and be real. We are excited to have champion parents and champion wife, Hawa Massaquoi-Carter. That name just flows. Woo!
Hi, everybody.
Hi.
Hi.
Yeah, she is here with us today to share some awesome opportunities with us. As a program director from Volunteers of America, she will discuss the HPOG grant, which stands for Health Profession Opportunity Grant through Volunteers of America. Welcome.
Thank you so much. Well, I wish I were a director, but I'm not. But I am one of the, services navigator or community liaison that shares information about the program. And I really enjoy the opportunity to do that whenever we get a chance. So thank you for this great opportunity to share about HPOG. So you want me to start sharing information? I have the presentation.
Oh, no, not yet. But we're appreciate you ready to take off. We appreciate that. So can you just tell us a little bit about yourself, Ms. Hawa?
Okay, well, I am a native Detroiter, born and raised Detroit, West Side, went to school in Tuskegee, Alabama, and graduate of Tuskegee, and I got a master's in organizational management, HR, and I'm a mom, wife, and I enjoy helping those in the community. I had a varied background. I worked in retail, HR, so now I'm in the nonprofit sector. So it's really a great opportunity to connect with so many great people in the work that I do right now. So I enjoy sharing.
So is that an HBCU you went to?
Yeah. Yes, HBCU.
All right. I went to Alabama State.
Okay, we all in this. It's love because we thought biggest.
Look, wait a minute. Look where I went to.
Well, I can't see. Where does it say?
She taking too long. I went to Central State University.
All right, HBCUs matter. I love HBCUs.
Yes, the best.
Great.
Are you showing us, Miss April?
You ain't see. Look. Like it's an NSU grad, so that's for Norfolk State.
Okay, Norfolk State. Okay, that's good. So definitely, yeah, HBCU. I love being there. Met my husband there, so it's just crazy. You know, I met a lot of lifelong friends there as well. So I really, I'm glad I was able to go to Tuskegee and come back.
Awesome. And you know what? Thank you for pointing that out. That is something that I love about HBCUs is that, you know, it's a family feel. It's nothing but family love. You know, I absolutely love my Central State family. So I definitely agree with you there.
Yes, definitely.
And you also get a high quality education.
Yes,
that's where I got my skills from. Alabama State.
I know that's right. Amen. I love it. Yeah, because we had the best professors. I mean, professors from all over the world. We have friends from all over the world, all over the country, places you wouldn't even think of. I had one of my girl classmates, she was from Colorado. I'm like, Black people live there?
Right.
When you come all the way from Tuskegee, so I'm glad I had the opportunity to go away.
Yeah, it really opened my eyes. You know, you so get used to when you grow up in Detroit, you get used to Detroit. Yes. But I'm appreciative for being able to go to Virginia because it gave me a different perspective. And gave me a different outlook. And then, of course, you know, surrounded by people that are like me and look like me and can support me. That was just the most important thing. So, Ms. Howard, what is the daily schedule like for you as a champion parent?
Well, I clock in a little bit later than most. I clock in at 9. So I work from 9 to 5:30 every day since we've been teleworking. So it's just been hard trying to navigate. I have one daughter, she's a middle schooler, so hormones, and I don't want to keep, like right now she's upset because she wants to get on the TV and watch something. And it's like she need a break. So we just gotta make sure we monitor that, and it's kind of both navigate watching, doing what we need to do for work and then helping her, because it's been a challenge. I mean, we only got one child, but I can only imagine what it's like for others who have multiple kids or don't necessarily have a support with that, someone to tell you to go in there and get on that computer and log into school. Some kids don't have that. So I'm appreciative of my husband because he's doing that while I'm able to do what I need to do for work. Because I mean, we're in the house, but I'm just saying because that's his background, education. So he's able to, help her, keep her on task while I'm doing this right now for work. So
awesome. Yeah.
Teamwork makes the dream work.
Makes the dream work, definitely, yeah.
I know you got a wonderful presentation you're ready to share.
Oh, definitely. Yeah. Okay, so let me share the screen real quick.
So champion parents, while we are waiting on Ms. Hawa to load up the presentation, please do not forget to share, type your comments in the comment section. If you have any questions, we are so excited to answer the questions. So come on in, y'all, ask those questions.
Can y'all see me right now? Can y'all see my screen?
No.
Hold on 1 second.
Yeah, and this is exciting because I never heard about the health profession opportunity grant. So I think our listeners will get a lot of information regarding this grant through Volunteers of America.
Okay, so now you see it.
Okay, yep.
All right, so this is what I do every day. Monday, Wednesday, my colleague, we both share responsibilities and sharing information with a lot of people in the community. Our job is to connect with a lot of nonprofits and other social service agencies and sharing information about how we can help those who may benefit from this great opportunity. So HPOG is the first step in a career in healthcare. We pay for healthcare training. So that's what I say, and this is what I'm going to talk about. So your first step in a career in healthcare, we pay for healthcare training and assist with employment. Here's what we offer. We offer training options. We offer certified nurse assistant, medical assistant, patient care technician, phlebotomy technician, EKG technician, and many more training options like medical billing and coding, medical office specialists. And then those who get into our program, they can take multiple training programs so that way they can stack their credentials and help them transition to a career in employment. So that's the goal. The target audience is those who receive food and cash assistance and live in Wayne County. So if they meet those criteria, we're able to assist them in getting into the program. So
what's the age? How old?
18 years or older.
18? Mm-hmm.
Yep. So we pay for their state exam and licenses. We offer career readiness workshops, in-office interview session with featured employers. We have partnerships with Henry Ford Health System, Sienna Healthcare, and many more. So does anyone have any questions where they see themselves in healthcare from our audience? If they see themselves in working in healthcare? That's one of the questions that I asked.
I know that I heard, I was talking to a parent earlier, and I think you had mentioned this at what point, talking about, what was it, lobotomy, and then there were some other,
phlebotomy,
right, is there specific areas that this grant is geared toward?
So really, there are entry-level positions in healthcare. So they basically, you don't necessarily have to have any experience. So like a CNA, certified nurse assistant, I mean, they may have different names, a direct care worker. So those are positions that those who may not have any experience, who want to get into healthcare. And really the goal is to get them off of food and cash and help change lives, because we want to end generational poverty. That's the biggest thing for this grant, is to help end generational poverty, because a lot of times, going to school is very expensive. So,
Yes.
So basically, the employers that we work with are Henry Ford Health System, Sienna Healthcare, ACR Medicare, and many more employers. So here's how you qualify. So HPOG, you be 18 years or older, you live in Wayne County, receive food or cash assistance, so SNAP or TANF benefits, a Michigan background check, be a U.S. citizen, a permanent resident. And
so I want to ask real quick, because you said receive food or cash assistance, and so that is the SNAP program and the SNAP for
TANF,
those.
Yeah, so SNAP or TANF, and they have to receive a notice of case action form that shows that they have those benefits, because we have to verify it. Long as they have those benefits at the time of enrollment, they're eligible. So it doesn't matter if they get $2 for SNAP benefits, as long as they're eligible at the time that they are enrolled, they are eligible for our grant.
And I just wanted to point out for our listeners again that the SNAP program was the initiative that Governor Whitmer began during the COVID-19 to assist our kids who were school age, from 5 to 18 years old. It's a temporary grant, but still, even in, like Ms. Hawa said, you still would qualify even if you receive that.
And if they're military or show proof of their military status, they are, eligible as well. So these are
if they're military but do not receive food assistance, they still qualify, or do they have to have both?
That's a great question.
Okay, then we'll table that and note that for later.
That's a great question. Yeah, let's table that.
Okay.
So, any questions so far about anything I've said?
No, I think this is wonderful and definitely well needed.
Great opportunity.
Yeah, definitely.
And then this is one of our participants. So this is Kaylin Langray, and HPOG was one of her biggest cheerleaders, because sometimes a lot of people that I interact with, they may not hear anything positive from anyone. And when they get in, it's life-changing. Because I remember a young lady, I gave her information and she just was crying. She's like, I never won anything. I never got anything. She couldn't believe that this was really real. This is real. If you qualify, you get in.
And it's an excellent opportunity, and it doesn't seem like you have to go through a red tape to get to it.
It's really, usually this process is a lot simple. So the first thing is that when they come to our orientation, they have to fill out a pre-screen, which gives us consent to do a background check. And once they do the background check, it'll take about a week or so for processing. And they can't have felonies, because working in healthcare, you can't have felony. And then some misdemeanors may disqualify them because of, working with sensitive information, like fraudulent activities, anything like assault, that may disqualify them. But if they don't have any felonies or misdemeanors, it's a smooth transition. If they had an expunged record, they still can qualify because their record is expunged. So. And then once they do that, they'll be contacted by our next team, which is the employment specialist team, and they'll do an eligibility meeting via Zoom. And then at that meeting, they'll find out if they get into Team T. So Team T means they get the funding from us to get the grant for their healthcare training.
Wow.
And if they don't get a T, they get a C. Now, C means that they didn't get the random, it's because it's a random selection process. So it's no guarantee they'll get the funding, but they have a 70% chance of getting the funding from us. So that 30%, we usually, circle them back to other resources like Michigan Works to see if they have monies or grants for school. But when they get in, they have a 70% chance. That's great to me, to get someone to pay for your school, and you can take you can take up to 3 trainings at different times. So once they complete one training, work 90 days, they can do another one.
And where are the trainings held?
Okay, we have training providers that we have partnerships with Wayne County Community College, Dorsey School, Abbott in Southfield, Healthcare Solutions, Career Group, Quality Healthcare Training, Helping Hands for CNAs, nurses, and Phlebotomy Express. So they spread out throughout Wayne County. Oh, and Marosa School of Phlebotomy. So depending on where they live, east or west, we try to tell them to go to those schools in that area so they can get there in a timely manner.
Oh, cool.
Yeah. So once they start the training, we're there to support them every step of the way. They graduate from our program, and then we help them get into employment. So that's another piece that we do, is I connect with so many different employers, and then they do on-the-spot interviews at our office, or via Zoom, I guess now. And then I mean, really, it's a simple process. They just got to do the work and be on time.
Right.
This is great. So I just want to know, are those individuals, can you go back to the one slide? Yeah, those individuals who are posted on the slide, do they provide the training?
Which one? No, which one? Mr. T and all those guys there? No, we just put, they are part of Team T. All their names start with T. So
Team T.
Because they redid our slide because they wanted to make it more appealing. Because it was,
I'm just playing.
It's cool, but that's Team T. So Mr. T, Ice T, and TI, so they're part of Team T, and it's to emphasize that you're going to be a part of Team T too once you get into our training.
Oh, cool. So our class is held on campus now due to the COVID?
Yes. A lot of the providers are open. They are considered essential workers, so they want people to enroll. So that's just, they have classes all the time. Like once we got the word that they were open, we had to set up differently, do our Zoom presentations. So a lot of once they come to our orientation, we'll get them enrolled in class. So it's a rolling enrollment, so they don't have to wait.
Okay.
As long as they come in and come to our orientation, do what they do their job and get the paperwork in, meet the meeting, we're quick. It's really a 2 to 3 week turnaround. It's not that long that they get in. I mean, it's really fast. So we want to help people change their lives. That's the whole goal.
Definitely.
And that's cool. That's really good. I pity the fool who doesn't sign up.
Right, okay. And then once they attend and finish training, they have to do their part. Time management is necessary. They want to try to keep us in the loop, let us know about that they completed their training, show proof of employment, update us. And again, we're here to support them because everybody in this presentation are participants in our program. So, and then this is what they need to do. They need to bring their photo ID, driver's license, proof that they received food or cash to their Zoom eligibility meeting. And then from there, we need to have a notice of case action form. So they need to show that they either have this form or have an account with M Bridges to show that they receive food or cash assistance. And that's it, really. Any questions or anything like that, ladies?
I'm just gonna say this is just, I mean, it's an awesome opportunity, especially when you think of now and the things that people are going through and people who are in dead-end jobs. And this is an opportunity to change your route, to do something different. Definitely.
Yeah. So we have a listener who wants to know, do you have any accommodations for people with disabilities?
That's a great question. A lot of schools do offer accommodation for people with disabilities. Mm-hmm. Interested in a particular program?
They didn't say. They just asked about accommodations. Yeah.
Oh yeah, definitely. Yep. Because most of the schools are really great at accommodating all the students if they need some accommodations. Mm-hmm. They're great at that. So. And this is my contact information. If they, want to email me or attend our orientation, I shared the link with Lisa so they can register online for our virtual orientations. We host them every week. So tomorrow we don't do them, but Wednesday at 3:30 to 4:30, Thursday 11 to 12, and then on Friday 2 to 3. So my colleague and I alternate. I do 2 and he does 2. And we just want to change lives and help people get into the HPOG program.
Nice. Wonderful.
Stop strings here.
And so somebody just wrote in, I am a working mom So how can this program fit into my schedule?
That's a great question. She's got if she's able to go to school during the day or at night, because a lot of our training providers have classes during the day or in the evening. So it depends on her schedule and how she will want to go about getting the training.
Oh, sounds good. I
Nice.
hope that
So
answered your
flexible
question.
schedule.
Mm-hmm.
Yeah.
Yeah.
Okay.
This was
Okay, so
very
that's
good
a nice
information.
Yep. Because I have
nice
a
schedule.
Yeah, so can you provide your follow-up or your followings for the viewers? I know you just gave your information.
let me put it back. I'm sorry, because I took it off.
Uh-huh.
Let me put it back.
Well, yeah, maybe just a quick, so they
Okay.
can make sure they get it. Yeah.
Okay, there it is. You see it?
Yep. Yeah, so to make sure people can, make sure they have it, because it's definitely beneficial, and it's definitely beneficial even now, for students or residents to partake in this program.
So 18 years or older, I mean, there's no age limit. We have participants in the program that's 60, 70. Some is, young as 18, 19. So, everybody doesn't necessarily know where they want to go to school, but, once they do, this is an opportunity for them to get that healthcare training paid for free.
Right.
So how, I'm not sure if you answered this or not, and please forgive me if you did already answer it, but how old is this program, or how new?
Well, it's been around since it started under the Affordable Health Care Act through 2015. So it started, they had HPOG 1.0 and started in 2010. So this grant is going into the 5th year. So we've been around 5 years.
Okay.
So that we got an extension in March for another year, and we hope to do, more work. It'll be more longer, because at some point we did offer LPN and RN dental hygienist trainings, but because we just got extension, we had to kind of scale back and just do trainings that are a year or less. So I mean, those who were getting the program prior to 2019, they got to take advantage of being an LPN and RN. So which was great too. We didn't pay for the whole thing, but it was some of it. We paid for some of it. So it's still a great opportunity for somebody to pay $8,000 of your bill to go to LPN school. I mean, because it's very costly. So HPOG helped a lot of people. I remember I attended a graduation for Dorsey last year. So I saw how many students that benefited from that. We had a graduation recently of a student. She got her RN.
Mm-hmm.
So, I mean, if they do the work, follow up, I mean, they can take advantage of this great opportunity. So.
That's great. Miss Hawa Massaquoi. I like that name. I just like the way how it flows.
Thank you.
Okay. But one of our champion parents wrote, how long does it take someone to graduate, and is the program self-paced?
I mean, depending on what training they want to do, some trainings, like say CNA is 2 weeks. It depends on what training provider you go to. It could be from 2 weeks to 4 weeks. It's one of our trainings that, like, they have CNA at Abbott, it may be longer. So some people need that, that they don't meet every day. Like the other ones that are 2 weeks, they meet every day, and they meet for like maybe 4 or 5 hours, but it's a lot of information. So it depends on what you want, what program. We'll try to find that particular, school that will help you where you are and how you want to learn the information too.
Sounds good. Does any of the programs, are they a year long? Do they take a year long to graduate, or they're less than a year?
Yeah, less than a year. So I think the maximum pharmacy tech may be 3 semesters. We do pharmacy tech. I didn't probably mention that. Pharmacy technician, central service technician. So those who helping working with the utensils, like equipment in the operating room. So that's a great program too. But a couple of those, they need to take a prerequisite that we don't pay for, but it's an intro class. So we let them know once they can get into the program that we don't pay for that one. But other than that, we pay for pretty much everything we offer. We pay for their school supplies, books, supplemental stuff. So if they need anything, we pay for it really. So it's a grant. And
So I have a question. I have a question, Howard.
Yeah.
And this is a little more personal. Like, how long have you been involved with this or the likes of it?
I started with them in 2019 because I worked in HR before that. So I wanted to work in the nonprofit sector because I really felt that, you know, I was helping people, but not in the capacity in which I wanted to. So I feel like because I enjoy going out in the community, connecting with people, this is an opportunity for me to do that. So I didn't apply for actually a case management position there, but one of the persons who did my interview, she said, well, no, I see you out in the community connecting with people. And that's what I've been doing. So we've been really good about getting our numbers, making sure we get the word out about the program because it's really great. And once people know about it, they don't believe it, but it's really true. It's really the best kept secret I've found out. I mean, because once people get in, the process is really fast because we are really trying to make sure the process goes fast so no one has to wait, you know.
Yeah.
So they come into our orientation, they have to do the work too and turn in the paperwork, but we make sure we turn it in. We have a fast turnaround. So we try to work with people. I mean, we want to help. We just want to help because we want to get them enrolled.
And you know what, that's why I asked you that question because, you know, when we talk about careers and things that we love to do, we have to some kind of way connect to what we're doing, which would, you know, it gives us passion, which means that we'll do a great job. We're excited about it. You know, so yeah, I was just trying to get to the bottom of things and see why you're doing.
Yeah, because I mean, I had worked, you know, again, I worked in HR. I thought I was going to stay there. It was just, you know, it's one of those things. I was like, let me try this. You know how you sometimes your life or God put something on your heart because
take a leap of faith.
You know, leap of faith. And then I will always know information. I always try to help people find information. If I didn't know it, I'll find it for them. So that's pretty much what I kind of do too, still in this role. I just kind of connect people with information and resources. Like a lot of people call it, we're not doing RN, but I found a grant that they can benefit from through the CARES Act that can help if they connect with their school. Is money available out there? So you just got to be diligent and find it, really, because it's resources available because of unfortunate of COVID, but there's some doors have opened up for a lot of other things. So we just need to take advantage of that and just be, you know, be prayerful and be diligent and try to help each other, really, because that's what we're here for, to help each other.
Yeah. I like that. So we have another question. Okay. Someone wrote in and said, once graduated, does HPOG provide nurse uniforms as a gift?
No, we give them nurse uniforms while they're in school.
Good. Okay.
While they're in school, we pay for that. We you know, we have contracts with different suppliers. They give them, I'm not sure how many, but that's something that an employment specialist usually does, but they do pay for their supplies and their uniforms. Yep.
And that's good because, you know, just looking at it as a parent, you know, uniforms can become very expensive. So I'm sure those nurses' uniforms become expensive. And I know somebody probably, just like, you know, our champion listener just wrote in, you know, that probably would prevent somebody from signing up like, oh, right. I might have to purchase a uniform, you know. So no, the program is really free. They provide the resources for you all. So they don't want, it's no barriers to the program.
Exactly. No barriers, not at all. Only thing I think that's more challenging for people now is that sometimes they're not really comfortable doing this technology because we are kind of forced to be in this space where we can't go to connect with people in our offices. So that may be a little bit intimidating to people, but once they see how easy it is, they're like, hopefully they see that it's easy to connect, but if they need help, they can always ask, we're here to help. So, because I had a couple of people ask me, I can't get to this Zoom, I can't do this. I said, just be patient. I'll call you and I'll just walk you through the process. So
that's good. That's really good. So are you basically saying failing is not an option in the program?
No, not at all. Because it's healthcare, and they, you know, in healthcare is really stringent, I would say, to get into the healthcare field. Yeah. But misdemeanors don't disqualify them. Misdemeanors don't disqualify, but it's depending on which one it is. Like if they, something that like assault or anything like dealing with fraudulent activities, anything like that. Because I know we had a couple of people that may have come in and it was hard for them to get employment. They, that was considered a misdemeanor, but they weren't able to get employed after they got the training. So we had to get a little bit more, I guess, restrictive as to what misdemeanors we will and will not accept.
And that's understandable.
Yeah.
Thank you for sharing this information. This is truly valuable for those in the community.
Yeah. Thank you so much for having me share it, because I'm glad, because this is something that I do all the time. So yeah, definitely it's an opportunity to share it.
Definitely. We definitely appreciate you for coming and spending your time here on Mommy Talk. And also providing, like I said, the information that's just overwhelming. It's really overwhelming in a good way, I guess. It's just good information, I would say.
Yeah, Steph, because it's free. And again, if I didn't work here, I wouldn't have known either, to be honest with you.
Wow.
It's right. We're right here. We're located. Our office is right there in the New Center One building. That's where we're located. So once, hopefully, all this COVID releases, they can come in and, or to come virtually connect with us either way, because we're here to help. And my number is available right there. And I look forward to seeing people and share information about HPOG.
Yes, come on, champion parents, go ahead, apply.
Yes, apply. So I can always share some flyers with you ladies too, about the different trainings in detail a little bit. I can share.
That's cool.
Because normally it's in our presentation, but they changed it up to make it more appealing. They had Mr. T's on there, so they had to change it up a little bit.
Yeah, it's cool. It was definitely informative.
Okay. Thank you, ladies.
Okay, so do you have any final thoughts of inspiration for our champion parents?
All I can say is God, just like today, I was sharing with them earlier how, trying to do what I'm doing, and then someone comes in and takes my money. Like I had my debit card and I didn't even go anywhere yesterday. Somebody took $340 from me out of my account. So, I look at it, I was upset, but I was like, okay, thank you, Lord, because if I didn't call because of something else happened, I would have never known, and it would have took all my.
You may not have known.
It would took all my. So I had to look at it from that perspective. I know the days look bleak sometimes for a lot of us, but we have to just hang on and stay faithful and encouraging, because we are in this together. We are not alone. So I know people think they are alone in situations, but you're not. You're not by yourself. Everybody's grass ain't all green. And we have to realize that, it's not gonna last forever. Because trouble don't last forever. It's only temporary.
Definitely.
Absolutely.
I like how you said that, you got to be more optimistic and take the silver lining and focus on that, because if you focus on a negative, that will perpetuate. So you want to focus on the positive.
It's like energy and it's evil. Once you let it fester and, let it boil, it could go to something else. And people get sick from being like holding on and stuff. You got to let stuff go.
Yes.
And I'm doing that every day. Let stuff go and let God, because God is here. And because we all are here, because he ain't done with us yet. We got a purpose, and that's why we're here.
Definitely.
Okay, well, church. Well, Hawa, thank you so much. I've gotten so much out of everything that you shared with us today. So I have this thing, and I'm going to keep saying it till it catches on, but it's be the giver of what you need. Many times in life, we are looking and searching for what is already within us. And so we must use that power to provide what we need, because in providing what we need, we're helping other people out. So sometimes we have to look within ourselves and search for what we need. And we have to understand that the questions that you have, somebody else may have those questions. So let us continue to work and unite and share as many resources as possible. Don't be selfish, good people. Uplift somebody today and be the giver of what you need.
Amen.
So yes, so thank you, champion parents. Thank you again, Ms. Hawa. Again, you have offered us much information. You've given us a lot to share. Thank you all for tuning in with Mommy Talk. Continue, please, to visit our website and give us feedback. Next week, we'll be discussing teaching opportunities with our guest, Miss Ebony Bagley. So anyway, be safe, you well, wear those masks, fill out your census,
Bye.
vote.
Bye. Thank you, ladies.
Wait, before we go, Miss Hawa, can you tell us what other colors can grass be?
She's the comedian.
I don't know, April.
Serena.
That's Dr. Burke. That's Christine.
Christine, I'm sorry.
I'm just playing. I'm just playing.
I don't know. I just know
It can be
pink and green,
brown.
though. I just know pink
So
and
Howard,
green.
you're gonna have to end the live.
Okay, I'm sorry.
Yeah. Oh no, you're fine. I was sitting up here looking for. I'm like, oh, I forgot. Boom.
Where am I? And how do I do it? Do I need to do something?
It could be brown. It could be blue.
It could be any color you want it to be. How about that?
Yes, any color
Any
you
color
want
you
it
want
to.
to be.
Whoa, we got a poem going here.
Any color you want it to be, because I'm glad it's starting to get a little green. So any color you want.
Yes. It's
Okay. End the
real,
live.
relatable, and right on time.
I don't know.
It's
In the
real.
upper left-hand corner.
Okay.
It's real, relatable, and right on time. Right on time.